All right, welcome everyone to this lab talk presented by Diaceutics. Today, our talk is Digital Pathology and Artificial Intelligence Application in Hematological Diagnostics, Game Changer or Gadget, presented by Dr. Mingyi Chen from UT Southwestern. Here is a look at today's agenda. My name is Ian. I'm a network development manager with Diaceutics. I'm going to provide a short background about who we are at Diaceutics, as well as for DXRX, which is our precision medicine platform for labs. I'll then turn it over to Dr. Chen, where he can do his presentation. And then at the end of the presentation, we'll have a few minutes for audience Q&A. At any time during the presentation, if you have questions, anything comes up, we have a box below the screen that you're looking at where you can type in your question. So we at Diaceutics, we're an end-to-end service provider and data analytics company, and we specialize in precision medicine. Our mission is better testing, better treatment. We're building towards a future where the testing ecosystem allows all patients to receive the right treatments at the right time. We believe that labs need to be involved earlier in the precision medicine decision-making process. We have experience in 96 disease pathways, and we've worked on every precision medicine brought to market with 36 of the top 40 pharma clients. And we also have a global presence, which allows wide knowledge sharing across a vast range of topics. All diagnostic labs and lab personas can find a benefit from a DXRX registration, regardless of the size of their lab. And we see this collaboration having a positive patient impact all over the globe. Our goal at Diaceutics is to break down global barriers between labs, and we see DXRX as the way to accomplish this. By signing up for a free DXRX membership, you're going to get access to things like our easy to navigate lab map US claims data dashboards. We also have additional dashboards on there. You have a curated feed of CDX and precision medicine news and resources. You'll have access to Diaceutics and pharma-sponsored collaborations for labs and pathologists. And then you also see more lab-focused webinars like the one that you're listening to now from speakers from a variety of institutions. On both the left side of your screen and the DXRX booth in the exhibit hall, you should find a link. If you have any questions, you can schedule a meeting with someone like me, a network development manager, to learn more about DXRX and then Diaceutics as a whole, joining our lab network, et cetera. If you want to sign up, we'd love to talk with you. So now it's my pleasure to introduce Dr. Chen. So Dr. Chen's a professor of pathology at UT Southwestern Medical Center, and he specializes in hematopathology. He earned his medical degree from Peking University and his Ph.D. from Kyoto University. He completed his residency at UC San Diego and Loma Linda University and fellowships at City of Hope and UCLA. He's certified by the American Board of Pathology, and he joined UT Southwestern in 2016, where he came from UC Davis, Sacramento. Dr. Chen's research focuses on cancer biomarkers, cancer stem cells, immunotherapy, lymphoma, leukemia, tumor immunology, GVHD, atherosclerosis, thrombosis, vascular biology, sickle cell disease, lipid metabolism, and digital pathology. He's published over 150 academic articles, 12 book chapters, and 120 abstracts. Dr. Chen's a member of several professional societies, including the United States and Canadian Academy of Pathology, the American Society of Hematology, and the American Society of Clinical Oncology. He also serves on the editorial boards of multiple journals. Thank you for joining us today, Dr. Chen. With that, I'm going to turn it over to you, and we're excited to hear from you.
Thank you, Ian, for the introduction. And it's my great honor to give a talk to share my expertise and my experience and knowledge in my recent research interest adoption of digital pathology and AI-based approach in the diagnosis of hematological disease. Now it is the timing adoption all this technology and evolutionally changing the patient's care and outcome. So this technology can be challenging, and it is just a game changer or just gadget. So today's talk, I have four objectives. First, I'm going to review the recent advantage of digital pathology technology adoption in hematology, especially using whole slide imaging, digital microscopy using the AI-based approach, provide assistance in diagnostic hematologic disease. The second approach, I will focus on the technology, how to use this technology, put in a specific clinical setting to improve accuracy and efficiency compared with the traditional conventional microscopy. The third, we will discuss how to use the AI machine learning streamline laboratory workflow, improve our daily working performance to reducing the error, to improve the efficiency, to improve overall diagnostic turnaround time in the appropriate timely fashion. Number four, we will discuss the challenging and the limitations of this technology and how the newer regulation from FDA and how to avoid the conventional pitfalls to transition from the conventional microscopy to digital pathology. So this is essentially last 2023, I edited a special issue working my close colleague, Human Rasidi. Now he's in University of Pittsburgh as the Associate Dean of AI in medicine. We invited experts in the field to summarize all this technology adoption in medicine, especially in pathology. So I will go over some of the slides in the next 20, 30 minutes. So the history of pathology from the 16th, 18th century, from autopsy with 19th century's microscopy, and the 1980s, the revolution changing using the immunohistochemistry for biomarker development. After 2010, the most advanced is molecular biology using in the diagnosis, especially for NGS analysis, which revolutionized, changed the patient treatment and clinical outcome. Now is another wave is using digital pathology, adoption AI assistant tools to improve accuracy and improve the clinical outcome, not only for diagnosis, but also for prognosis. So the current histopathology practice involving the human's biopsy from the tissue, like a GI biopsy, prostate biopsy, as well as blood. Like a blood is circulating in our body, like from the eye. From the eye, you can read people's soul. From the blood, you can read a variety of disease because the blood is circulating from our body. They can use it as a window to review all of the patient's bodies. And based on the biopsy from the tissue or blood, they put in the paraffin block, they make a section, provide like a glass slide. And then in the old days, we use microscopy. Now the technology uses digital pathology, they scanning the slides with whole mount slide imaging with digitalized. We can provide more accurate diagnosis using the AI tools. So improvement, all this technology from the whole slide imaging, as well as molecular biology, adopting the AI tool will be the next generation of diagnostic pathology. So look at this field is explosively expanding. The whole world, the market value of digital pathology is from $1 million, like $100 million to $1 billion each year. So this is the most recent data shows all these big companies, not only the pathology diagnostic company, but also the AI company, Google, all involved in the digital medicine or precision medicine field, adoption the technology to help provide a diagnosis. Now you will see, you will be overwhelmed with all this terminology, AI, machine learning, digital pathology. All this become a trend. They are revolutionized, changing the clinical outcome, changing our lifestyle, changing the way the traditional medicine and especially the pathology using to help us for the diagnosis. So this is a field that shows the milestone of the computational biology, pathology from the AI essentially from the 1950s, of which the concept of machine learning AI tools to evolve not only in the medicine, in every aspect of our life. I will go over how this concept coming, especially in the 2000, the whole slide imaging, the scanning, the resolution of the slides provide a great tool to digitalize the imaging, which can be used as to provide diagnosis instead of the conventional microscopy. In the near future, maybe we might be abandon the microscopy. We all use the digital imaging. So the tool, let's go over the history. How does AI come from? AI is a terminology. Shows they call it artificial intelligence. Basically, use a computer or machine to perform the task that normally required human intelligence. Actually, this concept is started in 1950 by Turing. He is a mathematician. He has the concept using the algorithm, the computational tools to help to provide a judgment. And in 1956, this was the name called AI was established by John McCarthy. He used the word called artificial intelligence. Actually, it is a terminology used instead of the human intelligence. Just means this is a computation tool to help us make a judgment. So this is the reason before we use this terminology, we have to be very careful. Like AI, it is capacity for machine to mimic what is human behavior. Actually, in another circle, the machine learning is a part of the AI. It is application of AI software to improve the computational system, automatically learn from the experience to expedite the programming. The deep learning is another subset of AI. It is deep neural network using several of layers of neuron between the network to input and output to generate the diagnosis, to generate the idea. This is exactly all these three terminology come from. So the supervised, in the machine learning, there are two ways. There is a generalized learning. Basically, you put all the data, you see the correlation. However, that's the big data, and the background can be murky. The most updated the machine learning is the supervised learning. You have to be designed, select the patient case, select the subject, and do a further correlation with the diagnosis, classification, progression, and from the input, generalized customized output. That's the mostly currently used, called a supervised machine learning approach. The AI-based machine learning that's exactly started from the radiology, and this is probably from a decade ago. They found that the AI-based mammography significantly improved the sensitivity to prevent the misdiagnosis and also prevent the overdiagnosis. This is exactly the same principle applied for pathology. In the glass slide imaging, use the AI digital pathology workflow, basically using the digital imaging, use the algorithm for the deep learning software to correlation with the imaging, correlation with the pattern recognition, which mimic what the pathology doing with AI-based software to provide an algorithm to predict the diagnosis, not only the initial diagnosis, but also provide information for treatment, to guide the treatment selection, and provide some information for prognosis and clinical outcomes. This is exactly highlighting the workflow of a deep learning approach application in histopathology. The task for disease classification, objective localization, and the nuclear segmentation, and further architecture with convolution neural network. In the end, output is precise diagnosis and provide guiding for the treatment. Whenever you use these AI tools, this is the pure mathematical models, and the selected training, select case is very important. There's two ways. You can use the underfitting, which is high biased and low variance, but you can use the low biased, high variance. This is exactly the green one. You have to choose in the between. Using the select case with the supervised learning tool, put a correlation. This is exactly the review article, if you want, can from Dr. Rasidi's review article in a couple years ago. So the AI approach in pathology, like they providing diagnosis, not only the initial diagnosis, but also for further classification, for risk stratification, provide information for immuno-oncology, biomarker development, as well as pathological reporting, and to improve the workflow of pathology daily work, to improve the turnaround time, but also as well provide information for prognosis to improve the long-term follow-up clinical outcome as a guideline, not only for the pathologist, but also for the clinician as well as patients. This is an example, the application of the digital imaging from the tissue biopsy, from the nuclear segmentation, and two-dimensional, even three-dimensional architecture. Use AI tools, give information for diagnosis, tumor classification, lymph node metastasis, prognosis, genetic correlation, and finally treatment guidance. Here is another imaging shows how the AI analyzer use the model for imaging interpretation. Whenever you have the biopsy, you have the digitalized imaging, you focus on the area you are interested. The AI tool can find a specific area with busy fields. For this field, future of a group of gland clustering which have a pattern recognition for invading to the stroma with kind of a glandular stroma damage. Further spatial monitoring to give a correlation with the CNN network to provide information. This is a metastatic or primary tumor. And the graphic convolution network, not only based on the nuclear, but also the three-dimensional architecture, which is AI tools can digitalize, computerized, quantified, give a specific number correlation with the prognosis, correlation with the predict the tumor grading, tumor metastasis feature, or tumor clinical outcome after treatment. Here are the clinical application in the lung cancer, which shows essentially a CT guided or ultrasound guided biopsy. Like I showed earlier, show the glandular architecture with stroma damage. This shows essentially not only the tumor, but also shows the tumor stroma with the stromal fibrosis, the tumor associated macrophage, and the tumor necrosis, and also correlation with clinical outcome. Further classified, this is the adenocarcinoma, well-differentiated, poorly differentiated, and also correlation with clinical outcome, how much necrosis after treatment. This is another ways to predict the prognosis. After treatment, the EGFR targeting therapy, usually the tumor become necrosis, atrophy, shrinkage, and the tumor stromal ratio become a decrease, and also shows tumor-related desmoplastic reaction, means this tumor response to EGFR targeting therapy. Further analyze the AI-based histopathology cancer diagnosis with a variety of adoption. Not, as I mentioned before, not only initial diagnosis, essentially based on the customized, this software can predict the patient's response to the biomarker development and the targeting therapy, and finally prognosis. In this slide, we have emphasized not only the whole tumor for each individual tumor due to the heterogeneity of tumor. Sometimes tumor have different differentiation, or even sometimes the cancer have a mixed phenotype. They have adeno and squamous. This is the reason they can use this digital imaging to quantify how many percentage adeno, how many percent squamous cells. And they use this correlation and predict the response and to quantify the mitotic figure, quantify the tumor-associated lymphoid tissue. Further, this is the application digital pathology used the AI to quantification of immuno-oncology profiles. Like I said, some cancer treated with checkpoint inhibitor, nivolumab, pembrolizumab response, they call the hot tumor, because there are a lot of tumor-associated lymphoid tissue, there are tertiary follicle. If you use block the checkpoint, the reactivation in immune oncology, your immunity kill the cancer. That's the reason they use digital AI-based tool. You can quantify precisely how much this tumor associated with the lymphoid follicle, which using as a reliable marker to predict this is a hot tumor, or even this less immune reaction, this is a cold tumor, to predict whether you apply immunotherapy and also predict this patient response to immunotherapy. Furthermore, and this is another slide, emphasize not only the tumor, but also analyze the AI-based tool to quantify the stroma, how many fibroses, how many tumor-associated the stroma reaction, desmoplastic reaction, how many individual cell necrosis, how many fibroblast response to the treatment. This is also given another information, how many vascular later related with the tumor before or after treatment. Further analyze the tumor-associated microenvironment before treatment or after treatment to show the response of the target therapy such as anti-VEGF or immunotherapy. This is another example shows the cytology. The cytology can be challenging based on single cells. Sometimes each individual cells can be looks different because of the cell differentiation due to the temporal spatial heterogeneity of tumor. This is exactly based on the AI-based allogram with 1,000 feet of the tumor cells in the cytology field, which is robust whole slide imaging and the cervical cancer screening and the pap smears to provide a diagnosis. This software developed Hologics is already FDA approved in the Janus digital diagnosis system as a screening tool as a pap smear, and will completely replace human being as a screening by cytologist. However, this system have challenging because this is a slide, the cytology. There are multiple layers. The focusing the slides, which I will show in the second part of my talk, as like a bone marrow, same principle because the layers focus concentration can be challenging. So the limitation is use AI-based software not only in the section cytology, but also in the gross imaging. This is the dermatology. Basically, you don't need a biopsy. You just take the picture for the lesion and use the AI-based tool to tell them the feature. Is this the melanoma or nevus? And how risk of the atypical nevus evolution to melanoma. This is another layer of study using called the dermatoscope. So deep, the deep learning approach, not only in using the pathology, but can also use immunology. Flow cytometry is an example because they can use the immunophenotyping, analyze thousands or millions of cells based on the cell surface markers for cluster analysis based on the immunophenotype to tell this is the leukemia, myeloma, lymphoma as well. Based on this kind of approach can put in not only 2-dimensional, 3-dimensional, based on the cell marker, put in a different category, use the AI tool to predict or classify the lymphoma, leukemia types. The most advantage this AI tools is used for minimal residual disease analysis. Like I said, based on the cluster analysis, the phenotype, you can find one tumor cell in 1 million normal cells. This is exactly the AI tool's advantage. Is way more sensitive than human beings, our naked eyeball. Furthermore, the new technology uses gene expression, uses the genome, not only expression the protein, and not only the basic morphology, because the tumor can have 1,000 feet, but the gene expression, the driver mutation is the most important. The RNA level is another layer of help to predict the treatment and further shows the tumor heterogeneity. And this is the high resolution genome can predict the tumor stromal microenvironment interaction in the single cell level. So this AI approach adoption in the pathologic diagnosis, not only, like I said, in the pathologics diagnosis, but also build some algorithm to predict the treatment response to help oncology make decision, especially in the future as a follow-up to predict overall clinical outcome. So my second talk, I'm a hematopathologist. My interest to using this tool to provide diagnosis of leukemia, myeloma, lymphoma. And my daily work is read bone marrow and lymphoma or peripheral blood tissue. This is my project collaboration with UCLA, Dr. Zhao. We use the digital pathology AI-based tool, develop a software and a computer tool called MorphoGo to diagnose bone marrow classification to help generate bone marrow report. if you know as a hematopathologist, our daily work is to quantify the bone marrow cells. In the bone marrow, based on this kind of spectrum maturation from the hematopoietic stem cell to evolutionally changing to the mature cells, basically have three class cells: white, red, blue. The white is neutrophils, monocyte, lymphocyte. Red is red blood cells. Generalized red blood cell carry oxygen. Blue is maculocyte. Finally, when they are peripheralized in the peripheral blood, they make a platelet. The main function is stop bleeding. All these three cell lineage in the bone marrow is a spectrum based on the human being classification, at least 50, 60 cell type in the bone marrow. That's the reason further classify this spectrum maturation can be very challenging. There are a lot of subjective issue and can be sometimes can be difficult to generalize the consent. So this reason every day when we get a bone marrow aspirate, we make a slice and then we stain in Giemsa. When we read each individual cells, and usually we under like 500 to 1,000 oil lengths, we tell each individual cell type to tell them this is the benign neutrophil, tells them it's myelocyte, promyelocyte, metamyelocyte, lymphocyte, plasma cell, as well as leukemia cells, myeloma cells. So this is the reason when we draw the marrow, you make the aspirate, make a spicule, put on a glass slice, you make a generalize the smear, and then you staining by Giemsa. And this daily work as hematopathologist, even my resident fellows, is to read bone marrow. Each bone marrow from the WHO classification, this suggested each case read 500 cells. With experienced technician or even my trainees, it takes at least 10, 15, even 20 minutes per case. If each day you have like a 10 bone marrow, you need at least 3, 4, 5, 6 hours job to quantify the bone marrow cells. That's a very tedious work. And another thing, this technologically can be challenging because lack of consistency is very subjective for the classification. Therefore, whenever you generate a report, there are a lot of discrepancy. So if we use these computer system, use AI-based tool, they can be generalized. The system can have achieving some standardization. This is the tool we help a company called MorphoGo. Basically, put the digital the microscopy inside of the instrument, and we build some software and AI tool to recognize each individual cells with whole slide imaging. And we generalize the classification and provide a differential. And finally, they have some experienced software in the cloud-based information to communicate with the computer to generate a bone marrow report to help the hematology oncologist for the diagnosis and treatment guidance. This is how this system works. The AI-based algorithm by the MorphoGo system, like I mentioned earlier, this system the most technical challenging is read on oil length on the 1,000 magnification. The scanning the whole slice is challenging because the focusing can be challenging. You need a multiple layer, sometimes in the selection bias, because in each glass slide, the cell number, cell density, on the oil length, or even the cell variability among different temporal spatial heterogeneity can be different. That's the reason you need a scanning multiple layers and reconstruct the imaging to get a clear imaging. Then you can use the computer AI-based software to recognize each individual single cell level to help them classification, finally, to generate a bone marrow report. This is exactly what I showed the technical challenging, because you see the glass slide, somewhere have more cells, some have less cells. That's the reason when before we read the cell, we always scanning the slide in the lower magnification to focusing a specific area. We call a good, widely developed, evenly distributed area as a high interest area for the high resolution scanning. This is basically focusing the picked specific interest area. And then when you really get the layers, like I said, mentioned earlier, due to the focusing challenging, you need to reconstruct imaging to generalize clear and readable imaging. and then use the software to have classification. Each individual cells, they look very similar. This is exactly the principle. How can we recognize cells? And my former colleague, Richard Levinson, he used to be training a bird, is a pigeon. They give the bird a group of imaging from the breast. Upper group is normal breast disease, lower is breast cancer. They train this bird 3 months. Actually, the bird can get 90% accuracy to mimic what the pathology doing. This is exactly what we are doing. This the computer software they call the YOLO. Basically, based on the cat's face, there are the color, the eye, the even the movement, they can generalize the digitalized or computerized imaging to the algorithm, tell this is the cat, this is the dog. We use the exactly same principle to tell this is the lymphoma cells, this is the benign lymphocyte, this is the myeloma cells, this is the normal plasma cells. And hopefully we can tell them the exactly same principle, tell which is cat, which is dog. This is exactly the principle, my colleague, Dr. Rasidi, have generalized. If you're interested, you can go to his website called Hematology Outline. This cartoon figure shows each individual cell. In the low part, they're almost identically same. However, each individual cell have a different nuclear cytoplasmic ratio, different color of cytoplasm, a different cytoplasmic vacuum or granulation. We can tell based on all these specific features, tell which is a lymphoblast, which is a erythroblast, which is a myeloblast. This is the real cell imaging. Here you see the erythroblast, myeloblast, lymphoblast, based on the nuclear feature, cytoplasmic feature, cell size, cell color, all this detail, very subtle cytological feature can give you specific meaning, and all this parameter can be digitalized, quantified as a feature to help you build for differential diagnosis. Further, this a system can use for all the bone marrow cell, have convolution neural network for the classification. And this software is essentially used for digital imaging, AI-based tool. As a pilot project, we use the validation of our system to use the initial confirmation this system works. Here is one of the case. You see the bone marrow cells, the variety of cells. Each cell looks similar, but they're not identical. Based on the cell morphology, we can tell this is a different blast, leukemia cells, or mature lymphocyte, or myelocyte, neutrophil. There are almost 30 to 40 types of cell classification. Based on the classification, we can tell is this leukemia cells, if possible, myeloid, lymphoid, monoblastic. And this is another field. All these cells in a different spectrum of duration, we put on based on the morphological feature, essentially details, nuclear and cytoplasmic feature, put in a specific category. Further, use this feature validation. We generalize this is the correlation. Use the human beings' experience, compare with computational analysis, validation the system, and you show the correlation. And further training of the classification and the mature lymphocyte can get 80 to 90% accuracy. However, some subtle cells from myelocyte to blast can have some very subjective abnormality. Then you need a consent. You need a group pathologist, general opinion to train the computer system to recognize a variety of classification of cells in a specific category. That's generalized the group of pathology experience, retraining, revalidation your system. Here is the project. Not only the lymphocyte, myelocyte, we recognize lymphocyte, especially in the bone marrow. Abnormal lymphocyte can have a sign for the patient may involve in lymphoma or diagnosis of leukemia, lymphocytic leukemia. And combined with flow cytometry, this data further correlation of these cells with the phenotype. And this is the conclusion. And we use this correlation. We evaluation almost 100 cases. We found a variety of patients have different type of lymphoma. Retrospectively, this is based on the computation software, do the correlation. And this is another example shows the development evaluation, variety of disease, which is unexpected to see the cytoplasmic granulation. They may be related with GCSF treatment or cytoplasmic abnormality, vacuole, hyperchromacity shows myelodysplastic feature, which is known as a feature of pre-leukemia condition. At the end, and there's another, so not only based on the morphological feature, but they can also based on the immunophenotype flow. They can in the cloud-based software using the data already diagnosis, retrospectively retrain your flow data can be incorporated as a part of the diagnosis, which is developed by the Hepaso, the company called Hepaso. Further, this is used for the MRD analysis, the pattern recognition, clustering of a group of cells which shows identical immunophenotype as the original leukemia. Further emphasize this is the MRD positive based on the flow data, use AI-based tools. That's the future. Combined with morphology, immunophenotypic finding by flow cytometry, immunohistochemistry, molecular study by fish cytogenetics, and NGS correlate clinical finding to help for build the final diagnosis. In the market, there are several system evolution. The cell vision is started first. They essentially build on the peripheral blood. They read on the 100 oil. This is the snapshot. It's not a whole slide imaging. This select field used for peripheral blood, but not for bone marrow. Scopio is the first system and built by the Israel company. Now they are part of the acquired by the American company. And recently the FDA approved their system using for both bone marrow and peripheral blood AI-based software for recognition. Hepaso, they have advantage use both imaging, flow cytometry, and as a tool to help build the final diagnosis. The system I help build is called MorphoGo. They use for both bone marrow and peripheral blood. They can be used for software with not only for the morphology, but also generate preliminary bone marrow report. You can find the detailed information in the literature. So in summary, digital imaging AI-based tools for the bone marrow analysis will be the next chapter of bone marrow hematopathology. They provide a useful tool for remote, real-time review the smears, not only the blood, but the bone marrow slides. They are easily recognized unclassified cells, which by the technician further confirmed by the pathologist, which can be replace a lot of human work to improve our workflow, improve our turnaround time. This virtual microscopy can provide a tool not only for consultation, for teaching, education, and for telepathology diagnosis. And the digital imaging integrated with medical record, clinical information, immunophenotyping by flow cytometry, cytogenetic NGS data can help us to establish the final diagnosis for provide information to help the clinician make a judgment or decision for the treatment, as well as these tools can provide information for as a follow-up to monitor MRD, minimal residual disease, to predict relapse, to prevent of the recurrence with maintaining therapy. So this is a summary of all the milestones, the AI-based, the 3 revolution. Now we are in the 3rd revolution. We have to take advantage of all these tools, use digital imaging, AI to put in a clinical diagnosis. The marketing is there, the technology is there. We have to be open-minded to adopt this technology, put to retrain them, to validate them, to put in our daily work. That's the future of pathology, of breeding the microscopy to computational biology to genetics as the final future of our medicine. However, all these tools have their pitfalls. If you don't choose wisely, if you use the wrong tools for training, you might get negative data. That's exactly the pitfall. They can waste a lot of money. That's the reason. Choose wisely and train the system and validate the system in the proper setting and validate, generalize in a specific hospital is very important to make sure your system works. The caveat. The AI deep learning can mimic the pathology thinking and pattern recognition. They can be help us make diagnosis. However, the correlation is not only also a final diagnosis. The reader's validation, data definition, algorithm training, revalidation, generalization is very important. Whenever you have indeterminate diagnosis, human beings still needed to be jumping in to help to revalidate data. There's another logical issues, the pre-analytic, the color of the slides, the selection bias, whether you're exhausting the slides, or how many cells you needed, the primary efficiency or long-term follow-up still need to be validated in a specific setting. Finally, the real world experience and the digital imaging, computation faked imaging, and you have to be correlate to be put in the real life experience to be generalized in a specific setting in your own lab, in your own hospital. And that's the reason I emphasized the pre-analytic or post-analytic revalidation is also very important. So why AI can help us, the efficacy? You will be surprised. AI will replace the pathology job. We will lose job. However, the God closed one door, they open another window. Actually, AI will be create a new job, such as we need to hire a lot of pathologists with this computation biology background to help the training the system, validate the system, and also have to be trained the next generation pathologists to adopt it or using this technology. Actually, the AI will create a new job and will make your job much easier. I want to show one of the example. Now in old days, I cannot write any poem in English. Now I use the ChatGPT. I put the keyword blood AI. Now ChatGPT can generate a poem, tell them what will be the future of hematopathology using the AI tool. This is a very nice poem, which probably I don't need a PhD to learn literature. And this is the take-home message. I use analog with Dr. Eric Kupel, shows how AI can change the medicine field. AI will not replace pathology, but in the future, the pathologists with training in AI will replace the pathologists without training AI. That's also the pitfall. If you don't use AI, if you refuse to use this technology, you might lose your job. That's the reason whoever embraces technology, who have more training and more welcomed using the technology, all this AI tool only make your life much easier. This is the last slide. I want to use as a motivation slide. This is the Mountain Everest. You know, when you're climbing, this is the highest mountain in the world, and there's no pathway. Either you find one or make one. We use this as a motivation, such as using to motivate us to try to adopt all this technology, using our clinical practice to changing the field, changing our future. And thanks for your attention, and I'm more than happy to take any questions.
Well, thanks, Dr. Chen, for that awesome talk, and we are excited. We'll anxiously await your award for the poem in literature when you win a Pulitzer for that. Thank you for all that information. So we'll do some Q&A now. At any point, if you want to ask questions, you should have a box below your screen that will allow you to type in a question. But the first one we have here, Dr. Chen, is how do digital pathology platforms ensure data privacy and security, especially when dealing with sensitive patient information?
That's a great question. I mean, not only digital pathology as a medical field protect patients' privacy or patient information, healthcare information, not only is many of these logistic issues, ethical issues related with the regulation. FDA or even the specific society, ASCP and SCAP have a specific regulation to protect patient information. However, when we digitalize this imaging and the patient information, especially the patient ID, will be hidden. We only give a number, it's decoded. You only know the patient. That's exactly, you don't know who is the patient, you only know the imaging with a specific coded digital number. Another thing, this imaging can be saved in a cloud base in a specific place, either inside a hospital or share with your consultation. As a matter of fact, at the beginning, and the patient information, it is protected.
Okay, thank you. Excuse me. Our next question, someone wants to know what kind of training or upskilling is required for pathologists to effectively use AI tools in their practice?
That's a great question. By the way, I'm a hematopathologist. I'm a practicing hematopathology more than 15 years. And I don't have any computer background. I try to learn programming and even learn from my younger son, but I don't get it. So but basically with all this technology evolutionary changing the field, you don't need a degree of computer science to using these tools. And all these tools, even this software, even the like a ChatGPT, DeepSeek can help you using this technology and make this smoothly transition. You only need a basic training. You don't need to be know how to coding to using these tools. And of course, if you have the background, if you have, I wish I have the background. I know I have a degree or in computer science, then I can much smoothly changing the transition of my knowledge, my experience to be using as a tools. However, in the future, the collaboration between a doctor, pathologist, as well as a computer engineer, the crosstalk collaboration is the key to enable the success or progress of this field. I wish maybe in the next generation pathologists can have some training as a basic training, which can really help you to moving this field forward.
Thank you. Someone wants to know if you could share any experience with lymphoma diagnosis, so solid tissues. Do you have any experience with that you could share?
And like I said, the lymphoma is a tissue. Lymphoma diagnosis and can help you based on the histology biopsy from a lymph node, from the spleen, from any solid organ with a lymphoid tissue. Based on the tool, the AI-based image can only tell you lymphoma, non-lymphoma, but cannot usefully tell me the classification. Maybe they can tell you the high grade, low grade. However, the true classification of lymphoma still needed, like I said, the immunophenotypic finding by flow cytometry, as well as genetic molecular diagnosis to further classify the lymphoma, classical Hodgkin lymphoma or non-Hodgkin lymphoma. But as a tool, screening can help you to give you a preliminary information, tell you it is lymphoma or non-lymphoma.
Another person wants to know if AI will be cost effective in the third world. So basically, if it's not the United States or other countries, will AI be cost effective?
Actually, it is. All this software, you don't have to be, some of them is cloud-based. You don't have to buy an instrument. Some of the built-in as an instrument, but some of them can be reached remotely. Basically, you uploaded imaging and they can analyze data in a different country. That's really help of the third world country without all these resources availability, and they can provide a telepathology or even provide a diagnosis remotely economically.
Fantastic. How do AI models deal with variability in slide prep, staining, and imaging across different labs?
That's a great question. Like in my last slides, we call it pre-analytic. Like I said, even the smear, the way you prepare a smear, dry tap or hemodiluted, or even the heavily overstained or understained. Because the AI tool based on the color, size, recognize cells. If you use a different color, your software may not recognize. That's the reason intra-observer variability is happening in human, but intra-machine variability happen in the AI tools. That's the reason although you train your system in a generalized training, when you move to individual lab, you have to do a minor revalidation before you generalize your algorithm software in each individual lab. That's the reason I wish in the future and all these like staining, the quality of slides can be standardized. This can be promote the widespread using the software. Otherwise, all these selected biased can have a challenging to using these AI tools. If you train in one lab to move in another lab, the color change, the software may not work well.
Mhm. That makes sense. How do AI algorithms in digital pathology handle rare hematological conditions with limited training data?
That's another great question. And generalized training, supervised training, you need your training set have a representative for all the. Instead of see the horse, we need to see the zebra. And you need, when you're training set, you need to put some rare case in your training set. In the future, whenever it happens, you still recognize. Not like I mentioned earlier, we are focused on the white blood cells, red blood cells, for example, malaria, or even infection disease. And, you need to put in a training set with such specific case as a training. However, in the truly zebra, you never see in the real life, and that kind of case, if you never in your library at the training, AI has limitations. In that case, is human being, our eyeball still useful.
Awesome. So the next two questions, I'm going to kind of roll them into one. Both are dealing with the economics of digital pathology and AI. So the first question, someone wants to have your thoughts of does the cloud, everything being in the cloud, if it's cloud-based, does that mean, or do you think it would mean free consultation? And the second question is, how do you anticipate the impact on labs in terms of economic costs regarding procurement of continuously evolving hardware, softwares, and upgrades? And would you recommend, should one wait at present, or how does someone go about trying out AI? Are there any cloud-based solutions, as you mentioned?
That's a great question. I mean, down in the future, all AI, the AI tools will be cloud-based, and you need to buy the space. And I can tell you, the imaging in 1,000 resolution is huge. Each bone marrow is gig-based imaging. And how this save the tool, like you mentioned earlier, the HIPAA, the privacy, and the regulation from FDA, and all these ethical or social economic issues need to be solved. At this moment, FDA have no specific regulation tell how we save this data and how we using the data share the imaging. And this is a lot of debate around the field. As a screening tool and all this software, or even you probably don't need FDA, because you still need a human being to generalize the bone marrow the report. And as a screening tool, you can use as a research. You probably use it as your internally, unless in the future, like the peripheral blood CBC data, the report is sent out without a human being look at. That case probably needs some regulation. And as far as you question the cost, and so far this instrument is still very expensive. Not everybody afford it, but with all this technology change and the software update and the price, even the resolution and the scanner, and the price will be significantly reduced. And in the future, the most common cost is not the instrument cost, is the labor cost. You need to hire people to scan in the slide. That's the most common part. You need FTE. Like I said, you shouldn't fire your pathologist, but you definitely need to hire more technical support. The computer engineer, or even the bioinformatic team, or even the scientist or lab technician to help you scanning slides, to make sure your slides scanning in the appropriate setting and proper resolution, or even update the software to incorporate into your the EMR system. So far, all this system, all this Epic or CERM, all this system, there's no interface with all these tools. So that's a lot of regulation, whether you can breed in all the barriers from the medical record system for these AI tools. They built called smart diagnostic tool, not only the pathology, radiology, called all these diagnostic platform incorporate into the medical record. That's probably the future. That's the reason pathology, radiology probably building as a single department called a diagnostic department.
All right. The last question we have here, someone wants to know if the digitization of tissue or smear, so cytology or bone marrow, by the machines, is it reproducible, the digitization?
My answer is yes. If you're not satisfied, you can redo it. But the tissue is different. I mentioned a couple of times, tissue you can scan a single layer because they are even resolution. But the smear, cytology, bone marrow, peripheral blood, most commonly we use an oil lens. Whenever you use oil lens, the focusing is the most technical challenge. How do you solve this problem? For human being, when I read the bone marrow, you know what I'm doing? I'm focusing continually to find the perfect field to read. I mean, we didn't notice that we are focusing. However, in the computer, when they lose the resolution, when they are blurring the imaging, they have to rescanning. This is the reason some company, I think Hologics or even Morphogo, they scanning multiple layers to reconstruct, to generate clear imaging. So sometimes they never know. This is a merge, the multiple layer imaging to make it more readable.
Awesome. Well, thank you again for taking the time to speak with us, Dr. Chen. Thank you for everyone that stuck around for the presentation, for everyone that asked questions. Stay in touch with Diaceutics, I encourage you, for more talks like this. And we hope everyone has a great rest of their day. And thank you again, Dr. Chen.
Yeah, nice to talk to you.
Thank you. Thank you, everyone.